After the surgery, what happens is we go in, we put your new hip or knee in. My assistants will close, so as they're stitching up your hip or knee, I'll actually go out to the waiting room and find your family members or caregivers. I'll report to them, let you know how they're doing. We often will take photos of the x-rays before and after, and I'll put them in your medical records, so you'll have access to those. People like to see pictures of the things that happen in the OR, and so we'll make sure that's available to you. And then you'll eventually roll to recovery. Once you roll into the recovery, or PACU, the post-anesthetic care unit, your family will be notified, and when the nurses in the PACU deem it's appropriate, they'll bring your family members in and they can visit with you while you're waiting to go either home in the case of outpatient surgery or up to the floor in the case of an overnight stay in the hospital. That's basically it for the time period immediately surrounding the operating room. On the day of surgery and for the first week or so, we stress similar things with hips and knees. Really what we want you doing is we want you to drink lots of fluids, make sure you're eating a well-balanced diet including lots of protein, and then from a wound management, wound care, and extremity standpoint, we want you using ice and compression as much as possible to help reduce some of the swelling and inflammation around your surgical site. If you stay on top of this, the combination of curtailing your activities and ice and compression will be your best friend. Because if you push yourself too hard, too fast, you'll stir up a lot of bleeding and inflammation around your surgical site, and then you'll need more pain medicine. If you need more pain medicine, you'll feel nauseated, you'll get constipated. Narcotics are sometimes necessary, but most patients who take them say they don't like taking them for those reasons. So we do our best to push and educate you to understand the importance of icing, compression, and then taking non-narcotic pain medicines like Tylenol and ibuprofen. And we'll make sure that you and your caregivers understand this. We'll have the follow-up instructions written out for you. You'll have a booklet, and you'll definitely get instructions that are fairly detailed from the nurses who discharge you, either from the PACU unit at the surgical centers or up on the floor at the hospital.